So thanks for everyone to be here at the end of this GeOnG. I know that some people already left. It's the last roundtable for this after these 2 days. So thank you all. What we are taking for this roundtable now is about data protection, regulation, data sharing, and this kind of problematic we are facing more and more now in the humanitarian sectors. Because we are managing more and more data, and we are centralizing more and more data. And so I really thank the panel to be there, because we have a great panel today. So we will start. We have. So we will start with Shadi from UNHCR. Here. Thanks, Shadi, for being there. Then we will have ICRC with Guilhem, Ravier. Then we will have Rahel from GPPi. Yeah. And then we will have Matthias from MSF. And we have Patrick from Harvard with following everything on Skype. And he will have a short intervention at the end. And I hope we will have time to have a discussion time at the end of the session. So thank you. And if you want to start, Shadi.
Stay seated. Okay. Hello everybody, my name is Shadi. I work with UNHCR Information Management Officer, and I was working before as Data Management Officer. Working with an agency like UNHCR, our core mandate is pretty much collecting information about people of concern, about refugees. It's basically about registration, and then we look for protection solutions, and then durable solutions on the long term, like resettlement. So that requires a lot of in-depth details, and we do a lot of long interviews sometimes with a lot of in-depth details, a lot of information, a lot of things that really very protection sensitive information. So data protection for UNHCR is something very critical, very crucial, and can be more important basically. And recently now, you see things are, operations are changing. Now we have more and more data sharings. We have data security is coming on the scene. Previously, we didn't have internet in all offices. Now it's everywhere. Now a lot of our colleagues, they put things on Dropbox, they put things online, Google Sheets. You have other tools. And for UNHCR, that created a lot of issues, and we had to find a way in saying, look, we should come up with data protection policy, because before that we were just following the overall UN protection policy. So today we will start with, usually I hate presentations with a lot of text, but it's a policy, so you can't make it shorter than this. May last year, UNHCR came up with UNHCR data protection policy. You can find it online if you want. I'll share the link with Selvi later on. And basically it focuses on these points. First of all, we have an inline international data protection, basically it's in line with data protection standards outside for private sectors and other other data players. When we say we're collecting data, sharing data, you should definitely have a legitimate basis and a specific purpose. It should not be just we collect data because you want to collect it. You should get, there should be a purpose, there should be a reason. Maintaining high level of data security for this data, how it's stored, where it's stored, all the aspects behind. If it's on paper forms, you should not leave these paper forms anywhere, where they should be kept, what are the policies, and about data storage, whether it's soft data or hard, soft copies or hard copies. Conducting data protection impact assessments. Now it's becoming very regular for UNHCR. So whenever we do an exercise, it has to be, you should have TPIA. So you just to know what's going on, how things are going. People of concern must be informed about how their data will be used. We should get their consent, and we should inform them that, for example, if we're going for resettlement, they should know that this data will be shared with country X or country Y, and they should know how and what. UNHCR implementing partners should adhere the principles of the data policy. This policy, it should be part of it, and currently all the new partners, they should actually sign and make sure that when we share this data with them, they respect all these things. Data sharing agreements should be in place prior to transfer, sharing any personal data. Sorry, it can be boring more than that, but it's a policy, so we have to deal with it as is. Now,
can you perhaps just tell a little bit more about data protection impact assessment, how it's look like?
Sorry, how it's
look like? What is it concretely?
When I was in Jordan, we had basically we outsourced this, so we hired a consultancy company. They came and they're like audits, very in depth, and they want to know everything and why you collect it and how you use it, and if you want to use it, you have to provide a lot of details for every single data element.
So there is no standard methodology within UNHCR for that?
Not yet. And just to give you a quick briefing, I'm 100% technical person, but working on the data protection side. So that's why my presentation has a lot of text, because if you ask me, usually it's all about numbers and figures. You will see none of them here today. So I can address, give you the address of, the contact of the data protection person who can answer these questions.
And I will talk a bit about DPI in my presentation.
Okay, great.
Data sharing, and that's a step number 2, because usually we collect a lot of data and then we have implementing partners. And who here tried to plan food distribution or any kind of distribution in the field with another partner? Basically, you cannot just go, for example, to Save the Children and tell them, okay, or working with WFP, and say, let's plan a food distribution. You have to provide them with lists. Break down how many families, what are the, what's the population. You have to provide with them, share a lot of sensitive data. And that's why data sharing, as per the new policy, falls under, should have a lot of things. You should not just start data sharing, and you should have a purpose for it. When you say necessity, you should, everything should need to know basis, so you should not share all the data. You should share as minimum as you can. Consent. Everyone should know that their data will be shared with other agencies if they want to receive assistance, and other points that I'm not going to through them, but I'm going to now make it a little bit hopefully interesting by talking about one of the initiatives came from the field in UNHCR, which is called iCloud. It happened in Jordan. So previously, if you want to share, if you want to do a food distribution, we will go to WFP, we'll give them a case number, the principal applicant or the head of the family name, and a family size, and where's the location. We try to make it a high level of aggregation. So for example, instead of saying they live in this neighborhood, we're definitely saying they live in this city, just for them to know and do the logistics required. When we introduced iCloud, everything became totally it's just a different aspect. So instead of sharing our data, we will give them anonymized data set for them if they want to do like a model, like prediction, poverty prediction model, or something more mathematically sophisticated. And then whenever they identify their cases, they will send us the anonymized IDs. We will then just send them back the case number of UNHCR, and that's it. Refugees will go to the distribution centers, and as you can see here, refugees will approach the distribution center. They will just go provide a refugee certificate, which is has the UNHCR number, and then they will do iris scanning. It will ping our server, and our server will reply with yes, it's the right person, or no, it's not. With this new way or methodology of data sharing, we actually have now 7 partners using it. Some of them, they don't even need data sharing agreement because it's so basic. It's just literally, we're giving them a case number. It's like very basic data sharing agreement. We're not sharing any data elements, and pretty much that's it. Any questions about this?
Thank you. Thank you, Shadi. Any quick question? Or we can continue. Really clear.
Sorry. Who keeps the biometric data?
Okay, so as part of UNHCR registration, we collect refugee biometrics, and it's stored in UNHCR servers. So basically, the idea of the whole new way of sharing data, that it's actually the biometrics and all the information stays on UNHCR server, and all you get is yes, no answer, and that's it.
And so, when you ask for the biometric data, do you tell people what you do about with data? I mean, do you have policies for sharing this kind of biometric data?
Sure.
Or do you?
So for the time being, this data is not being shared with anyone at all. Now, in case we're going to share this information in the future, and I don't know if it's happening, but when I don't know if it's happening as like looking forward to share this information. All the refugees will be contacted, and they will be informed that your biometrics will be shared. Are you in agreement with that or not? If they say yes, then definitely then it can be shared. No, then definitely will not be shared.
And can anyone remove its biometric data from your server?
Sorry?
Can anyone remove its biometric data from the server?
You mean they request that? Yes, sure, sure.
And
But it's part of basically it's part of the process of UNHCR registration.
how many biometrics do you have?
I don't have an accurate figure, but we have few servers, so it depends on it's regional servers.
It's like million, hundreds of
Pretty
million?
much. If you talk about the Middle East, and for example, this one is like the regional server in MENA. I think the last figure was roughly around like 3 million or 2.6 million.
And where are the servers hosted?
Which servers? That's the question, because again, it's different regions. So for example, we have a project called BIMS, which is hosted in Geneva, and at the same time we have local servers that actually, due to connectivity issues, you cannot always have your server in Geneva. So we have a copy of a copy of a small data set that can be on the ground, and it syncs back to the main server, which is based in Geneva. For example, BIMS is running in few countries in Africa. I think now we're deploying it in Northern Africa. We were in Thailand, I believe, recently. I'm not following the deployment team info.
And what happens if the states ask for this if the states where the data is hosted asks for
We don't share it.
What
Simply.
happens?
We say we cannot share this data. We're also a UN entity, so they cannot just, you have a lot of diplomatic clauses there, so you cannot just go to us and say, we want the biometrics, we'll say no, simply. But again, you have also, as part of being in the country, they require some data element to be shared, and usually we inform the refugees that if this data if we have as part of the close agreement, we will mention to the refugee that this data might be shared with 1, 2, 3, 4, and we make sure that they have a full consent and they sign on it. And we still, I would say most of the countries use like paper forms, all of the countries actually. There was a plan to upgrade it to electronic, that where you sign that consent that I know my data will be shared.
Thank you.
You're welcome. Other
Thank you.
questions before?
I think we can just continue.
Thanks a lot for inviting me here. So my name is Guilhem. I'm the head of the protection of the civilian population unit in ICRC. I'm not a specialist of data protection either, so I will present a few elements, but I'm not. So we have the support of colleagues, including from UNHCR, to help us find what are the relevant rules. And I'm going to speak today. So it was a very good introduction to start the conversation, because we have been working on this with UNHCR and many others, but looking beyond the individual practice of individual agencies, the effort to define common standards to all humanitarian workers regarding the management of sensitive information. So we published in 2009 a first edition of these standards. So it's this document. It exists in Dette format as well. It's mostly addressed to humanitarian and human rights agencies that carry out what we call dedicated protection activities. So the main focus is fairly narrow, but it's not only for those. And in particular, there is one chapter 6, that is related to the management of sensitive information, that concerns a much broader set of practitioners, and even beyond those who see themselves as humanitarian workers or humanitarian agencies. So already in the second edition that we published in 2013, we had substantially revised and expanded chapter 6 to take into account the evolving practice of the use of new tools and new technologies in humanitarian work, and including the role of voluntary and technical community, the crisis mappers, the use of satellite imagery, the aggregation of data published on Twitter or whatever, to take into account the challenges that are posed by these kind of practices. They can have, they are shown to have great added value, but they also pose important challenges in relation to data protection in particular. So we published a revised edition in 2013, and we are now already in the process of preparing a third edition, because the field has evolved, and in particular the questions of data protection. The legislation and the regulatory framework related to data protection has evolved a lot, and it's important that everybody is aware of the constraints that it poses, because you can't manage data as you would like to. You have to respect the law, and sometimes you have to respect several jurisdictions, depending, and that was the very good question you asked, where are the servers located, where you are operated, with whom you share the data. So you have to be aware of different regulatory frameworks. So we are working to expand the different elements, and in particular chapter 6. So this is a quick overview of what's in the document. Most of these chapters will probably sound a bit esoteric to you, so they are mostly focused on the work of humanitarian and human rights protection agencies. But the first chapter on the overarching principle is quite important, related to do no harm, impartiality, non-discrimination. And chapter 6 is obviously the one also that will be most relevant to you. So we are now in a phase of consultation. The document is far from being finalized. We have identified a lot of elements that need to go into the revised edition, but we want to make sure that these elements capture the views, the consensus of the very broad community of practitioners that are concerned, and also respond to the challenges that you are facing, basically. So we have some draft documents that will be circulated. They will be even posted on the internet for people to comment freely. I think we will try to circulate it via CartONG to the persons who were here, to ensure that you are able to comment. But it's far from being a closed document. It's something where we want to gather inputs in order to ensure that the document is relevant and responds to the different types of challenges that you are facing in the field, that it's also intelligible, that it responds to the needs of people from different backgrounds and different expertise, so not too much jargon and technical wording related to only a few of the practitioners. So I will give you a very quick overview of some of the elements of the revision that we'll put in particular in chapter 6. So these are the main areas of the revision. It's chapter 2 on protection strategies, chapter 6 on the management of sensitive protection information, and as I said, so the regulation regarding the collection and use of personal data has evolved a lot, but we want also to highlight better the difference between sensitive data and protection data, because protection data, it's what we call protection data. It's data related to abuse faced by people in the field. So you may document actively information regarding the different types of abuse people are facing. That's protection data. But you may be not carrying out any type of activity, you may not be carrying out protection activities, but you may still collect sensitive information that is not protection information, but that can be very sensitive. There was an example that was shown to us a few days ago of a drone flown over temporary shelters following a natural disaster, just to map the temporary shelters. And you could think this information is quite innocuous, but on the side of the camps, people had started to build some houses. So it was invasion of public land. You could see the foundation of new houses on this land, but people didn't have any title to this land. So if the video or the pictures of the drone were shared with the state authorities as it was, you would have exposed these people to an immediate reaction, eviction, or even some kind of violence, destruction of the properties. So here there was no protection dimension in the project, but there were threats to the people if the information was not curated and managed properly. So we want to clarify these notions, and so you have protection data, which is in general sensitive data, and here we also see sometimes some very bad practices. In some other countries we saw Excel sheets of victims of sexual violence with their names, addresses, and plenty of details being circulated from one NGO to another with the UN, with the donors and all that. So even for very sensitive information we still see very bad practice, but it's also important to understand that beyond this kind of objectively sensitive information, there can be many other factors that make the information that you collect and manage sensitive, and whereby you also need to be aware of these standards and be able to apply it. And so there is an important difference between also protection data and data protection. Protection data is particular to the to information collected in relation to protection issues, but data protection is much broader. It applies to everyone. Big companies, Facebook, Nestle, or whoever manages personal information, including us as humanitarians or anyone who collects information with personal detail, must abide by personal data. And this is where also the regulatory framework is extremely important to know and to understand. And some other elements we are revising, but I don't need to go into detail. So very quickly on data protection, and I will not go into all the details, but it's I wanted just to highlight a few elements. There is a broad definition of personal data. It's not just names and addresses. It can be many other different things, including videos, location data, IP address. The importance of do no harm as the founding principle on which we must work, and also the importance of ensuring, maintaining, and promoting the trust of beneficiaries and of people we work with, and also of the states in which we operate. But data protection is on the rise, linked to technological development, and basically the idea of the efforts to strengthen data protection is to strike a balance between the protection of individual rights and the necessity to process personal data. So we can, and it's part of our humanitarian work to process individual data. There is no absolute prohibition, and we've managed in the past years to obtain some kind of caveats in the development of regulation to accommodate the specific needs of humanitarian agencies. But we must ensure systematically this balance between these two elements. So the regulatory environment was already quite developed, but has been very much strengthened. And here I will skip rapidly over these elements. I will circulate the slides in any case. But the latest element is this EU General Data Protection Regulation that creates very big demands on anyone who is managing personal data. And in particular, that if there is no safeguards, you can't transfer personal data out of the countries that are covered. There are many national legislations that are being set up, and now many countries have legislation, and this is going to grow ever more. It's not just a few countries in Western Europe and in North America, it's worldwide a growing challenge. I found the question that was asked regarding the location of the servers is quite important, because the UN and ICRC, we are fairly well protected because we benefit in most places where we work from privileges and diplomatic immunities. So it's quite difficult for any state to seize our data, but we are still quite careful. Our servers, ICRC servers, are all located in Switzerland because that's the place where we have the best protection. So most of the all of the personal data we manage is in servers in Switzerland. But we are still trying to push as well to ensure that NGOs benefit from some protection, that you can't have the police getting into your offices and seize your servers wantonly. There was a famous case a few years ago where the University of Boston, it was not exactly humanitarian work, but history of the conflict in Northern Ireland. They collected information, testimonies about former fighters in Northern Ireland, including on some important events, murders and all that. It became known. They published information anonymously, and so prosecutors came to them and asked them, well, we are very interested about this case, so we want the name of who is the witness and who are the different persons cited. And that's how I think it was Jerry Adams that was briefly interrogated, and so here they had collected information, personal information, that they didn't have the ability to protect from the prying eyes of prosecutors. So it's important when you collect information to ensure that you don't collect more information than what you can effectively secure, and in some cases to decide, if you can't guarantee the confidentiality, to decide to collect less data than what you would need. And these are the basic principles to conclude. The need for fair and lawful processing. You must have a legitimate basis for data collection. That's one of the main elements. Informed consent is the main legitimate basis for data collection and processing. But if you are not able to obtain consent, there may be some other legitimate bases that allow you to collect data. For instance, if you learn about people being detained, people being disappeared, obviously you can't ask their consent for data collection or data processing, but you have vital interest, which is one of the additional legitimate bases that can allow you to collect personal information and to process that personal information. Purpose specification, as was already mentioned, you collect data for something specific. You can't have a big net to collect every data passing by. Data minimization, I mentioned already, collecting only the data that is necessary for your project and not more than that, and not more data than you can secure. That's one of the main elements of data security. Data quality, obviously, ensuring that you know the quality. It doesn't mean collecting only good quality data, but it's about knowing the validity and the quality of the data, the possible bias in the data collection. And data retention, you may not have to retain, or you may not be able to retain your data forever, so you must set standards regarding how long you will be managing this data. And data subjects also have rights. That's also related the question on access to or deletion on biometrics. So people about whom you collect data have a right to access this, to correct it, to rectify it, or to delete it. It's not absolute right. Sometimes you may have also a legitimate basis to retain the data and not delete it, but it's still part of the balance that must be ensured. And as data controller, we also have obligation. Data protection by design is one of the key elements. When you design a data collection tool, data protection must be at the core of it from the beginning. It cannot be something that you slap on it afterwards, because by definition it will not work. There will be some gaps in your data protection. So that's one of the main elements, and the other ones I won't go into detail. I will skip a bit. I wanted on the challenges. So all these elements are creating a lot of challenges on our practice, because we need to abide, but we also need to do our work. So it's we can't spend days working on responding to regulations and all that. We must also have a certain efficiency on our work, and we can't spend millions on this. So it's important to always seek the balance, but to keep in mind the importance of data protection. There has been several initiatives, and I will mention this one. Some of you may be aware or may be involved with the Brussels Privacy Hub, working on the implementation or the how these constraints and regulation apply to different types of technologies, and what would be the good practices in implementing them for different types of technologies, including biometrics, drones, and others. So there are quite a number of documents have already been published and will be published in the future. There has been many consultations. And to conclude very quickly, as I mentioned it, the data protection impact assessment, it's a tool that must be used whenever you collect information whenever you process information or you consider transferring information to someone else. But it doesn't need to be always something that you know that you do with consultants. It depends. It's a practical tool, and it depends on the scale of the data collection. If it's a fairly small scale, it can be something that you do in 1 or 2 hours with your colleagues. It's just a systematic reflection regarding what are the risks of the data collection, what are the intended benefits, and how can the risks can be mitigated to the greater extent possible. So that's a process. Sometimes it can be done very quickly, but when you are planning a data collection for millions of people with biometrics over several countries with different agencies, there you obviously need to invest a bit more in it to ensure that you have not missed a few of the important elements. For the moment, I just have a few elements to share with you, but it's something that we will elaborate in the standards in particular. So that's an example when to carry DPIA, and it must be also often documented. It's not just that you do it and then it keeps in your mind. It should be also documented so that your followers or the people that will continue the project as well can track back what was the reflection and build on it if new elements arise. That's it. Thank you very much.
Thank you, Guilhem. I think we can go directly to the next presentation.
Just in the meantime, then maybe someone can ask a question.
For the revision of the standard, when is it expected? At the end of 2017 or?
We plan to publish. We will be gathering inputs over the coming months until Christmas probably, and then we have to incorporate these elements. So we plan to publish in about a year, September, October next year. And to make it also, for the moment, it exists only as this document in paper and in PDF, but we want to have a series of documents that are complementary, a more simpler one and possibly a more comprehensive one with examples and illustrations.
So, for example, for DPIA.
Exactly, yeah.
Excuse me. Were the guide translated in any other languages?
Yeah, it exists already in French, Spanish, and Arabic. And there is a short e-learning also that presents it rapidly.
Okay, thank you both so much. I hope I won't double too much on what's been said, because I think a lot of the important points I want to bring into the conversation have actually already been addressed. So I'm really happy to hear about actually both of the developments happening, and yes, we'll just offer a few additional thoughts. To my background, I'm Rahel. I'm a researcher at the Global Public Policy Institute, which is a think tank in Berlin. And my journey towards data protection comes from a research project on technology uses in conflict settings. So the result just came out as a menu of options that looks into how monitoring is used, how technologies can be used for monitoring in conflict settings, including Syria, South Sudan, Somalia, Afghanistan. And if you work in these countries, one of the first things that comes out is that if you can collect more data in really sensitive areas, more people will be interested in this data as well. So what do we do with this? And so I'll throw in a few ideas. I'm going to claim that data protection has currently an identity crisis. I cannot work this. Oh, there we go. Okay. So data protection, I think the term has a bad reputation, I would say. It sounds dry, it sounds really legal, it sounds complicated, and I think it sort of sits in a lot of organizations in the data privacy data protection corner, where some people are, shouting things, telling you that bad things could happen, and oftentimes, and I do work at a big development company right now, and definitely see this happening, where data protection sort of is the thing that comes afterwards. We have to think about it. Damn it! It's constricting us in our work, and worst case. Especially for those of us who are excited about technology and new data collection efforts, data protection can be a blocker and actually say, no, you're not allowed to do this. In addition, oftentimes when it comes to open data and data sharing in the humanitarian space, I see that security or data protection is also often used a bit like a scapegoat. Oh no, I can't share this data, it's sensitive, which stands in the way of a lot of the efforts that are being discussed here at this conference. However, things have changed a bit in the last year. Data has become more important, and yes, while data regulation has updated and changed a lot, I would actually say that it hasn't quite kept up with what data has been doing in the meantime. So data brings a lot of new exciting opportunities, like oil. It powers a lot of things, including mapathons and more, but it also introduces a bunch of new problems. So I would say that data protection has become more complicated, and perhaps the legal stuff that used to be out there is not enough anymore for our days. I simplified into 3 problems. Problem number 1, personally identifiable information. This has already been addressed. One of the core things about data protection is to protect personal information. Personal information used to be a name, an address, biometric information. However, it's not so easy anymore to say what personally identifiable information is. And I use this slide because it's a really interesting research project by someone who looked at his own phone's data. So basically got a log of like all the little moments when the smartphone connects to telecommunications antenna, whatever it's called, and looked at the data that was available to his mobile network operator, to his mobile company. And it's nice because when you look at it, you see that at 1 a.m. in the morning, here down there, he was reading an email by his boss. At 8 a.m. in the morning, he was sending a WhatsApp to his girlfriend. The way that you could find just by looking on his smartphone data that it's his girlfriend's, because you could look up here into the different emails that he has, the different accounts, and based on who you contact, these are all the different people. Oh yeah, Dietmar explained it. Look. So the Tansitzma is the person that did the research, and based on sort of extrapolating who you're talking to at what time, you can find out who these people are. All that to say, this is a lot more personal than a name. This is really like interesting, actually. And I mean, the more we get interested in mobile data collection, the more we get interested in GPS coordinates, which are really useful for finding out where food distribution happened, for example. It can become really critical depending on who has it in their hand. So personal identifiable information is not so easy to identify anymore. This is difficult. Number 2, informed consent. We also heard informed consent is the tool to get the legal basis on which to do data collection. However, even informed consent is tricky, because I have to say I'm someone who thinks a lot about data security and privacy. I'm not super technical, but I think about these topics, and I have no clue what I'm agreeing to by even using a computer, I have to say. I use this example. I don't know if anybody recognizes the symbol. It's a fairly old example, but in case you haven't heard it yet, you need to hear about it because it's really interesting. This comes from the US, not Humanitarian at all, but regardless. It's a company named Target, which is one of the big, like a Walmart-style organization that, sell stuff. And have also these wonderful customer cards, where whenever you buy something, it records what you're buying and stuff like that. It's all quite neat. And there was this case of a young girl shopping at Target, and all of a sudden receiving advertisements to her house about babies and about pregnancy. And the reason this became a scandal was because the father had not yet known that this girl was pregnant. The story sometimes gets skewed a little bit, that even the girl didn't know, but that's not true. I think she must have known because she was buying things. But the idea is, again, like the things that we do, the stuff that we buy tells more about us than we know or people know about us. And equally, I would say, I think this has also been said in the last 2 days already, I'm 100% convinced that my phone knows more about myself than I do. It knows, when I click at what, for what reason. It probably knows how I think in a certain way that I wouldn't know. So again, informed consent is difficult when it's hard to explain to people what might happen with the data that you're collecting if I don't know myself and if the people in the field don't know themselves. And number 3, legal questions. A lot of the legal questions that we need to ask have not been asked yet, I would argue. I don't know if you can read it. It says your test results came back. I'm assuming this is perhaps a doctor. I'm especially worried about your credit score. And the reason I put it in there, I don't know if it's true, but actually credit scores in developing countries, especially we see a lot of mobile banking applications in Africa. I've heard, it might be a rumor, that there are mobile companies that are using mistakes in text messages to do credit ranking about people, right? So if you get a lot of phone data you can get a good idea, you know, how reliable a person is and if you're going to offer them credit services or not. And so again, the idea being that health data about us that comes from totally different places can be used against us. But it's hard to spot these things. A lot of questions haven't been asked, and I would argue that our sector, even though we've heard about some two very, very important examples of what can be done, I would still argue that our sector does not think about it enough. I would say that we often say, oh, and data protection, and we have to worry about that, but are not actively actually doing enough, trickling down all the way to the field and all the way to everybody working. So this is a quote I got from the research. If the Taliban could intercept our emails, they would be building better bombs. Which, to me, is a really important quote, because it says several things. Number one, humanitarians, especially in the field, really have more important things to worry about than email encryption, right? However, I don't know if the Taliban can intercept emails. I really don't know. I know that it's not so difficult to intercept emails. The background for this quote was we were talking about smartphone for data collection, and there is an encrypt option, but if you encrypt the data you're sending via smartphone, it gets a bit slower, and so in this context the person chose not to use the encryption option, which also gets at the point that, you know, a lot of the tools out there, usability is really important, security is often not quite so usable enough yet, so hopefully more things will change in that space. But an interesting point to discuss, I think. So yes, would they build better bombs? I'm not sure. I think it's not so difficult to get, you know, someone joining the Taliban or whoever who has these skills separately and so forth. And then there's another quote by some smart person saying there are two types of companies: those who get hacked and those who will be. So that's I guess the answer to the previous quote. I mean, it simply is true, right? I mean, there's like, apparently in 2015 all companies were expecting to be hacked within that year. This is where the private sector is at, and yes, the private sector, you know, worries about its data in a slightly different way. However, we, and we've heard this too, have a lot more precious data to worry about, I would say. But is this always on our mind or not? And do we really need to wait for like the first really big scandal to happen until we really all take this up, not just, you know, the standards that are being written about all of us all the time? However, to make it a little bit nicer, another very smart person, it was not Sherlock Holmes, but it was someone else who's very smart, said the data tsunami is not a natural disaster. And the reason I like the quote is data tsunami coming from the point that we are collecting more data, more stuff can happen with it, da-di-da. However, it's not a natural disaster, we can control it. So I'll quickly say 3 little things that all of us can do in our daily work to perhaps get the data protection a little bit more natural. Number 1, it says, wait, has anyone done a privacy impact assessment? We've already talked about impact assessments, so I think this is a nice one. We need new intuitions. It does not say institutions, in case you misread that. I hope we did not. We need new intuitions. I would argue that to think about where can data be leaked, where can data turn harmful on us, do no harm, it needs just a new feeling. Just the way I walk down a street and I developed an intuition whether or not I'm going to be worried, whether I'm going to feel secure or not. I think we need to develop these same things for technology, for data. So we need to look out better for like where is potential harm being done and so forth. And I think we need a new language, because oftentimes data protection is very regulatory heavy. It gets even funkier in the cyber capacity, cyber security space. These terms are a little frightening, and it sounds like the IT people should take care of it. But they should not. It's really, all of us need to be discussing this. We need awareness. Or new risk assessment tools for our data. And what I'm trying to show here is a so-called threat model. I'm not sure if everybody's familiar with threat models. It's something that's used in IT, in building software. The idea is if you're going to build a technology tool that's going to contain something valuable, in this case data, before you're building it, you're going to think about all the things that could happen to it. So you have an asset. The asset is information, could be personal information. And then you think about who else might want to steal this data that I have. Who might want to have it? Maybe, in our case, maybe it's the government in the state that we're working in. Maybe it's the Taliban. Maybe it's, you know, my enemy, my business competing person. Maybe it's whoever. So you think about who are these possible people, and then you ask, and how could they get at this information that I have? How can they attack it? What are the possible existing vulnerabilities? Is it, you know, on a computer and they can steal a computer from me? Okay, in that case I have to think about how my computer will be more secure and so forth. So what I'm saying is, and I was very happy to see that data protection impact assessments are a part whenever a new technology is being used, or should be, because whenever, especially we're introducing new technology tools, it's really important to think these things through. Even if we can't, you know, predict everything that possibly could go wrong, it's good to at least discuss, you know, and have a conversation and ask everybody else, you know, who's out there wanting to get our information, how could they get it. This is a neat example I find. I was saying I think we need a new language. We need to make this very accessible to everyone. I was also talking about informed consent. This is an example of an NGO when they started using YouTube. And when they started taking videos and for the first time saying, okay, we're going to put these videos on YouTube, they were thinking, how can we get informed consent? How can we ask the girl that we're filming if she's okay with being filmed? How do you explain YouTube to someone who doesn't have access to the internet? So instead of saying, you know, is it okay to put it on the internet? They said, we're going to film a video, we're going to have a conversation. Is it okay if your friends see this conversation? Is it okay if your family sees the conversation afterwards? Yeah, okay. Is it okay if your boss sees it? Maybe not when she's 14, but is it okay, you know, if he can access it? Is it okay if the police can listen to this conversation? How about the government? How about people with money? How about the whole world or other evil people? So what I liked about it is it's very simple, right? So trying to make it very real in a sense of, you know, not saying, you know, terms of services didn't read check, which I do in my life all the time. Trying to make it very tangible for the people we're working with. And we need to talk with everyone. More stuff there. So starting conversations, and I'm super happy again to hear about the consultations. Bringing people together at different levels within our institutions. We have different aspects and different concerns about privacy and so forth. So bringing everyone together and saying, okay, what are you worried about? You know, what are you scared of? What could go wrong? What needs do we have? And last but not least, the data tsunami is not a natural disaster. However, if it would be, and there's our little friend, the data from the data protection corner again, if it would be, humanitarians should know how to respond.
Thank you. Quick question. Or we can start with Matthias. Maybe you can switch.
Okay, so my name is Matthias. I'm working at MSF Switzerland. I'm a health information system project manager, and this is exactly how I came into data protection. The reason is when we are defining a system architecture, we have to think of potential implications, and defining those implications afterwards when the system is designed and about to be deployed in the field is not a good moment to do this. So that's why we are looking at it right now. I'm focusing today really on medical data protection. For us, what does it mean? Maybe I'm sure it all looks familiar to you guys, but it really starts from paper collection supports, patient files and registers, which is what we call routinely collected data. We also collect epidemiological data through specific surveys or more qualitative assessments. We're doing also epidemiological surveillance by reaching out to either to other UN bodies, NGOs, or to the Ministry of Health in the countries where we are working in. And we are also collecting lab or biometric samples, medical imaging, anything of the like. To some extent, we could also consider photos and videos as pieces of data as well. Handling data for us involves all the processes named on the slide, and I kind of insist in the fact that it goes as far as destruction. It's something that you insisted on. It's very important to make sure that you have a disposal process for your data in case, for instance, you have to leave the country or you are ceasing your activities and you are handing them over to someone else, then you must know what you're going to do with the data. So for us, the transfer from paper support to electronic format is done in different ways. In electronic format, we are mostly collecting programmatic data, so data that allows us to make decisions. It's basically quantities, numbers of patients, this kind of information. We are also collecting more personal information for what we call our vertical programs, so centered on one disease. It could be HIV, tuberculosis, or more exotic diseases that require a specific data set because we are very likely to do research on this data over several years. Another important factor that we have to consider is that we are more and more moving towards individual data collection in electronic format. It's because our programs have changed. It's also because we are addressing diseases like non-communicable diseases, so diabetes, hypertension, and we are now getting cohorts of patients that are reaching thousands. And even though they are not necessarily complex to assess in terms of number of variables to consider, it's important to keep individual information if we want to make sure that the treatments are adapted to the evolutions of the disease. And as a general statement in the organization, there is a growing appetite for more and more individual data. It's because of the technologies evolving and the fact that digital patient files are almost at hand, and it really could make a difference in terms of patient support. So it means going beyond programmatic measurements, but also using data as a direct support for care, which we have kind of failed to do up until today, but it's really one of the next steps for us. Of course, when all this information is made digital, it's directly creating bigger risks because this information becomes more portable. So data at risk, it's something that has been repeatedly mentioned today, so I will not really get into details, but we are talking about directly identifiable data. So it could be beyond name, it could be your social security number, GPS coordinates, identifying your house, and I'm being quite precise here, your house, not like the neighborhood where you're living or the village of origin where you're coming from, phone number, this kind of information, which we generally don't collect as of today, but that we are very likely to start collecting in the future. I'm thinking of phone numbers, so as to send reminders to our patient for a diabetes consultation. That's something we could emphasize in the very near future. We consider also identifiable data a combination of several elements that could narrow down the number of people concerned to about 10-15 people. Then from this moment, we consider that this combination or this set of data is like having the person's name, and we must take specific precautions to safeguard it. Sensitive data for us would be mostly data relating to violence, to termination of pregnancy, or disease, disease that we call stigmatizing, socially speaking. So, and it will depend on the context. So, if you are HIV positive in Malawi, where the prevalence is about 30 to 40%, it's not that sensitive, as opposed to if you are HIV positive in China or in a specific town in China where the prevalence is not high, then it may cause authorities' attention on you being, I don't know, a drug user or something of the like, and it de facto becomes sensitive in this context. So yeah, it has to be, we tend to think that there is no overall hard classification of what data is systematically sensitive versus non-sensitive, and a lot of it takes a lot of training and promotion with our teams to spread this knowledge. The risk phase could be threefold. So it's a risk for individuals in case of mismanagement. It could be a penal risk. It's a risk also for our patients, for the taken from the example I just mentioned. And it could be also a risk of image for the organization in case there would be a security breach and our data was kind of hacked, and not necessarily by someone who's sitting in a remote place. It could be someone from our staff. It could be any kind of threat. So the principles we are looking at, it has also been quite well covered. The first two, they relate really to proportionality, keep the data adequate to your real needs. It could also have direct impact on the systems we are designing. If we decide that the content has to be very well controlled, it's quite a challenge to organize your data collection system from a distance and make sure that locally people cannot add any variable that they would like to collect, because at the same time they need some flexibility because of the projects they are carrying out, and it becomes de facto a real challenge. Patient's consent is obviously very important. Confidentiality and security by taking protective measures. It could be by preventing access to the locker where the servers are located, to make sure that this is really prevented from anybody. And it sounds very obvious and simple, but I'm not sure it's the case in all of our premises, to be honest. And ultimately, what's important as well is the quality assurance, like to make sure that the data is valid and well monitored. I will briefly focus on emergency context, because they are creating, well, the way, the very nature of this context make it quite difficult to handle. So for natural disaster, we have to be very reactive. We don't have, we are on the move from the onset of the crisis. So it means that we must have defined content, standard content available for use right away. But still leave it open for marginal changes from people actually doing the data collection to adapt to the specific context where they will operate. And it also means that in terms of system, that we have to automate data exchange and make it quite frequent, even daily, is something quite important. For a crisis like Ebola, so hemorrhagic fever on a large scale, data security is very, it's a very sensitive thematic, because I guess you know the areas of those Ebola treatment centers were differentiated between the places where we provide care to patients, which is kind of a very restricted area, then an intermediate zone, and then finally a kind of normal zone, an open area, where you don't need to wear special equipment. Well, data transfer from one to the other is an issue in itself. Also, we know that there are technologies, wireless technologies, enabling us to transfer technology very easily. We didn't have the proper tools in place at the time of this crisis, and it came so quick that it took us too long to develop adequate tools and use them for this crisis. So one of the things we learned is, of course, being better prepared for data collection, and it's a different thing to collect really a lot of patients constant, like almost several times a day, and then transfer them. It's not only counting patients, it really goes beyond that. One of the lessons learned is that the premises organization should allow for oral communication for people standing in both areas, because when you have one person equipped with the full masks, 3 pairs of gloves, staying in the restricted area for 30 to 40 minutes max, it's sometimes easier to transmit the information orally by talking to somebody who is standing maybe 5 or 6 meters away from there, but who is able to encode data either on a tablet or even on paper. And in case we move towards more, for such an acute crisis, a dedicated tool with encoding from caregivers, it means that we also have to think of the way we encode data. Of course, avoid any narrative and let users pick variables from user selections in order to to spend less time working on the data and still make it usable. So that would be some of the specificities of data collection in those contexts. So for us, how to move forward, we have difficulties to reach consensus and provide a guideline such as ICRC because we found that because we are at the crossroad between operational ambitions, legal concerns and ethical concerns, striking the right balance is very difficult. So enforcing very specific rules proved inefficient in our case, and that's why we decided to build rather a framework, and that's what we are trying to work on right now. And then we know that it will take a lot of work to bring it to our field resources and let them like get hold of those of this framework and bring changes in daily operations. So that's going to be our first and key challenge. Other challenges we are facing in terms of data protection is secondary use of data, meaning when you collect data routinely for several years on a given cohort of HIV patients, for instance, then this data becomes quite valuable after some year and you want to do some research on that. Then it was not intended from the beginning, so it's raising a lot of questions like, do we have to go back to the patients and ask them consent to publish research results because we have used their data? This is all the things that we have to define now. Another thing that we found difficult is how to work with governments and how to translate our use of data into official documents. We are already, we make it clear in the memorandum of understandings that we sign with governments that we are collecting data, for which purpose, etc. But it's quite limited, and it will take us quite some time to find the appropriate way of formulating our request and changes to those official documents. And then finally, the use of digital files will raise new concerns and new protective measures, digital measures mostly. And finally, data destruction is also something where we have to consider in case we are handing out projects, in case we have to evacuate. We have really to determine who will be the holder of this data as we leave, or if we should even destroy this data, depending on the context where we operate right now.
Thank you. Thank you very much.
So we have one speaker waiting on stage. Yeah, we can't hear you very well.
If we all have a round.
Okay, I can try to go closer. Is this any better?
Yes.
Yeah.
Perfect. Okay.
Great, should I go ahead?
Yes. If you can introduce yourself and we are listening to you. Thanks.
Sure. Well, so first let me apologize for not being there in person. I think it would have been a very good experience. I'm not sure this panel is the most joyful. I'm sure there were more joyful part of the conference, but this one is actually one that's not going to go away. It's only going to get worse. So I'll pile on a few more gloomy or pessimistic comments, and then try to add a few maybe exploring some solutions. So my name is Patrick Vinck. I am the Director of Research at the Harvard Humanitarian Initiative, and I'll really be talking from three perspectives. One, the perspective of someone who has collected a lot of data, primarily from the perspective of being based at the American university, which has a fairly strong framework around the protection of human subjects. But I also talked from the perspective of someone who developed a tool, Kobo Toolbox, which is now largely used in humanitarian crisis. We receive about 700,000 submissions every month. We are basically facilitating the process of collecting data for many organizations, especially during humanitarian crisis. And the third perspective is the one of looking at new streams of data, looking at big data basically, and trying to understand what those data mean, what can we do that's useful with them, and how do we do it in a way that is responsible, in a way that is really focused on value for action, value for the communities at risk that we are concerned about. So I have the big advantage of coming at the end. That also means I'm the last hurdle before you can all go home or go to more pleasant things. So I'll try to be brief. And focus really on some of the things that I have not necessarily heard as clearly in the previous comments. It doesn't mean that those other elements are not important, but in many ways I think they have been discussed. And there is a lot of discussion around data privacy, data protection out there, certainly a lot of resources. Some of the elements I wanted to point out, maybe four of them. First, hyper-targeting. We heard about that a little bit, but what hyper-targeting is really a commercial advertisement process, right? As you browse, organizations collect information about you so that it can target you, trying to guess what you may need, what you may be interested in reading, what you may be interested in clicking on. Now, if we transpose that, this is actually a fascinating tool, right? It means that we can gain major efficiency if we better are able to track from people's registration, profile, behavior. We're better able to understand their needs, then we can be very efficient in providing solutions to them. But the negative part of that, of course, is that we are building profiles. We're trying to guess and assuming information about individuals that, one, never necessarily consented to that. Two, as we contact them and build these, we are very close to profiling and doing things that are frankly dangerous. I mean, we might, if we transpose that to insurances, it could be denying services to someone who we deem is too risky. Well, in this case, it could be, trying to understand if somebody might, for example, have HIV/AIDS. Now, that's an important thing, and if we can provide solution, if we can help them get better care, that's actually valuable. But in that process, we are profiling maybe because I heard somebody earlier saying, well, they don't spell right, so they have bad credit record, so they are poor, so they need assistance. I mean, you can go on, and you're profiling people, and that information, we see it as being valuable to do good, but it, of course, can be used to do bad things. A government might use that kind of algorithm, that kind of discussion, and trying to profile people to understand, does this person present a high risk of cost to my health system as they are trying to apply for their refugee status? That's very much the policy in Canada, right? If you are at risk of creating a very strong burden on the health systems, you might be denied entry as you try to migrate there. It's a bit different for refugees, but anyway, so you understand the point, which is that this information that is very valuable for positive action, the same information can, of course, be used to deny people services or discriminate against them. So that's the first point on the hyper-targeting. Maybe the second point on data ownership. Now, the traditional discussion on data ownership would discuss, well, do people own their own data? Do I own the data? Let's go a little bit beyond that and figure out that when we talk about data ownership, there's at least three factors to take into account. One is yourself, your organization, and how it handles data. But it's also the policy of any tool that you might be using. And so we heard questions around, well, where is the server? Well, it's not just about where is the server. That's the tool or the clouds that I use. What's the policy on data access from those organizations? Can they access it? What can they do with it? Can they read it? Can they share it? Can they sell it? So there's a lot of aspects that deal with the provider or the solution provider, if you want, the tool, what's their claim of ownership, what is their right of access to the data. And the third component, of course, is the legislation, the region where you work, the region, the country. And we heard a bit earlier that this is changing quite quickly, and it's going to change even more. The things that we're able to do now are not going to be possible very soon, and there are a number of regulations that will be very different from country to country, so we need to understand that better and create that kind of landscape of regulation so that we understand what risk around data ownership may exist. The basics, of course, and that was the case that was mentioned on Boston University and doing interviews with former members of the revolutionary group in Ireland. We do not have, as humanitarians, but more generally as researchers, we do not have the same type of confidentiality protection that doctors or lawyers have in some countries, in most countries, I think. Which means that when we promise confidentiality, when we guarantee anonymity, or at least confidentiality to the people we talk to, in fact, whenever our records are being subpoenaed, we are liable and we have to show them, and there's just no protection. And so at times some universities will fight those claims, but how do we do it when we are in a specific country office? How do we do it when we work in a regime that might be challenging to argue with, to say the least? What's their claim of data ownership around those? And can we, just because we don't like a regime, can we just say, well, no, we don't want to give it to you? I mean, what's the policy? What's the approach to do that? And so there's a lot of challenges around this data ownership that are important. And I'll maybe tie that with the liability, and liability at several levels. Now, we heard, well, you need to be ready to destroy your data and so on, and that's important. What about the people you work with? What about your local staff? What about the individuals who are collecting information that may be liable for the information they collect? In most countries, learning that a crime has been committed, doing an interview in a household where you clearly see that a wife or a child or the household member, a man of course, has been beaten, you have to report that kind of crimes. What's your liability for doing that? What's the protection that you give, not to your data, but to the people who collect the data? And so at times, there was that mention, well, data protection is confusing. Well, let's talk about subject protection. Let's talk about data collector protection. Let's talk then about the data protection itself. But those are interlinked. And on the liability part, what's emerging as well is what hacking, and as we are going into the digital world and all of our data are stored one way or the other, what is our responsibility if we actually do get hacked? What is our responsibility in protecting individuals whose data have been stolen? Now, in the private sector, it's fairly clear, and Target was mentioned, and they compensated, and there are lawsuits for these kind of things. What's the liability that we are getting exposed because of these risks, and are we ready to manage them? And do individuals have a right to protection? Is that clear? A right to protection of their information, and how do we enforce that? Maybe one more last one. So I talked about the hyper-targeting, the data ownership, the liability. I've got some others, but let me just mention one more on group privacy. Everything that we've heard around consent, around data ownership and so on, is very much focused on individuals. But there are many cases where that's not sufficient, or certainly that's the way it is used now, but it raises a number of concerns. Think about the biological specimens, DNA samples. That's the clearest. I know it's the applicability in our case is not as clear, but I think it's the most telling example. If you consent to give me your DNA so that I can analyze it and look at a number of things, you are actually consenting also for all of your relatives, all of the people that share at least some part of your DNA. Somehow now I'm getting information about them. That is also what has been referred to the ghost profiling that Facebook does. In other words, you may not be on Facebook. You never consented to Facebook collecting information about you, but enough of your friends are, and your friends are talking about you. Well, now I actually do know a lot about you, even though you never consented to it. So that issue of consent as it is currently defined is still extremely important, and we don't do it well enough. But not only are we not doing it well enough, it's going to be even complicated, harder to do in the future, and so we really need to rethink that. And so let's go into what some potential or some areas of solutions. I certainly don't claim to have solutions, because these are usually difficult questions. But aspects that don't come very often, of course, we talk about standards and protocols, and those are super important. But let's first talk about literacy. How many of our basic trainings include components around and understanding around ethics and data protection for all actors? Not just the people in charge, but when we recruit individuals, is that part of the package? Generally, it's not. There are a number of trainings out there, but certainly not enough and not targeted enough for humanitarian actors. And maybe more important is, I don't know who is in the room, but I can suspect that the majority are international NGOs, and the dialogue that we have as international actors is extremely valuable. But that's far cry from the level of discussion and level of understanding that we find in most places on the ground. Local organizations are the first responders. Local organizations are the ones putting together an Excel spreadsheet, because that's the easiest tool that they have, and they put the names because they need to be able to track people, and they share that information. And so there's really a lot of work that needs to be done in preparing those first responders, preparing those actors on the ground. Not to single out, because we all do it, but it was funny, the response on I heard earlier, well, we subcontracted the local actor, and that's what we all do with our data collection. So we may have a fantastic, beautifully crafted policy within our organization, but we are subcontracting the data collection itself. How does those organizations operate? What's their approach to liability? What's their approach to protection of the data? Now, in most cases, we'll just include a clause that says, well, you agree to follow our standards. But if we don't train people to do so, then those misunderstandings are going to emerge, just because they might be cultural, they might be just a lack of practice. I mean, there are certainly issues that we need to address frontally in terms of training and equipping our partners in dealing with data protection. And the last point, and I think that touches on many of the fantastic fronting process around principles, around making sure that every organization do have some data protection policy in places and so on. Regulation is going to happen no matter what. We heard what has changed in Europe, and it's going to go further than that, and so regulations are going to emerge. So that the things we are doing today are not going to be possible in the future. But it's very important that let's call it an industry, we are able to demonstrate our ability to self-regulate. We are making the case that humanitarian disasters are a specific context, that in times of crisis, maybe some of the regulations, maybe some of the things that we do need to have a different set of regulation than politics as usual. In other words, if there is a disaster and cell phone companies have data that show where people are migrating, where people are evacuating, maybe even individual data that show people who are trapped within building and so on, then of course you would want that kind of data to be made public. And so you want to create a framework that allows for this type of public-private partnership, for this type of rapid release of data. That is not something you would, of course, support in any other context. So how do we make a claim for the uniqueness and some margins that we would like to be able to gain when it comes to data in the humanitarian space? Well, we have to show that we know what we are doing, and at the moment that's not always the case. So there are just a few thoughts and comments. I look forward to discuss more, and again, regretting that I'm not there in person, but these are all fascinating and tremendously challenging questions. So I hope that this discussion will continue well beyond the conference. Thank you.
Thank you very much, Patrick. So I think it was a very, very interesting panel. So we reached the end of the roundtable, but I would like to have a discussion. We can take maybe one or two questions with the panel, because I think the subject is really interesting. So please.
I was curious to know which encryption tools you used or recommended for your data protection, in terms of like data encryption or even email encryptions. If you had like go-to tools.
I would say that's a bit tricky because like these answers, most of them are corporate answers. So for example, your email, you can send an email and you can make sure it's encrypted. But again, as mentioned before, send an encrypted email, you have to send an encrypted email, then you send a separate key with a separate way just to make, so if you ask me, for example, things can be very simple. If you have a flash disk, make sure you have like BitLocker. Make sure it's encrypted. Your hard drive, if you know that you have important information on that drive, make sure at least it's encrypted. Or most of the computers currently, they come already with something like the BIOS itself. It has a lock and it locks the drive. So you can do simple things. And if you want to talk about corporate level, that's totally different level, because honestly, there's no firewall that you can't crack. It's just a matter of time.
I would just to quickly add to that, I would say the same thing. Like, there are really good tools out there, and I'm really happy to point to resources. Email encryption, personally, PGP, which just stands for Pretty Good Privacy, remains sort of the most commonly used and useful tool in that sense. However, it's totally different if you are an organization, if you're an institution. And I tried, even in my little think tank, 30 people, I tried to get us all in an encrypted email, impossible. So try being a big organization. So there's a difference between, what do we personally do and what do we do on an institutional levels.
Are there any organizations that store their highly sensitive data in, let's say, neutral territory? Let's say I collect data in the field, but I transfer it almost in real time or after a few days towards Geneva, and then make sure that I don't have anything locally, so that I don't have any obligations towards my local authority. Are people doing this?
We do occasionally. We don't do this as a standard procedure, but we do this for specific programs related to violence, where victims of violence could realize after a few years that they want to prosecute the people who harmed them, and maybe they don't get access to a copy of their files locally, so then we are keeping this copy. But that's for very specific context. And then I'm thinking of another example on also a vertical program dedicated to multi-resistance TB management. We need to collect a very broad set of variables, and it does include sensitive data. We do replicate it in a central server located in Europe, but that's only for backup reason. It means that in this location, nobody can actually access the files. It's just in case that the production server and the local backup server crash, which is very, well, it is unlikely that both crash at the same time, but we do replicate the data in a central place. But we don't use it, we don't give any access to people working from headquarters to actually access this data.
And you can
just building on that with digital data collection, I would say it's increasingly common for people to store data remotely in the cloud, and so that circumvents that kind of issues, but it doesn't address two other ones. One is even though your data might not be easily accessible from a local government, it still exposes potentially your staff, your team, who may be interrogated, of course. And then in many countries, in fact, we face the opposite problem, which is that, especially when it comes to medical data, for example, the data cannot leave the country. So you have to actually set up local servers in order to comply with the law.
And sorry, just one compliment is the information we are sending out of the country is fully anonymized. Like, it's not only removing names, it's also removing dates of birth, this kind of stuff.
So let's say that we are doing a result survey and we are doing a reassessment, right? And for the practical context, we will use some cloud instance. Is it acceptable for you as a panelist to have In fact, as we are reviewing the people on a regular basis, people will be, or the household family will be a number, and we will have a registry key somewhere within the institution. And for the sake of the exercise, we are collecting the data with a unique number through a cloud solution. Is it something that is safe enough for you? Do you think that it puts us to risk the people if at one point we are, after transferring the data into a local server or kind of things?
Just keep in mind something. The minute you put your data on a cloud, who owns the data is very controversial.
Yeah, but
you can't take it away. You can't take a copy of it. And you can ask Google to delete it, but do you have the right to do that? For example, when you say,
unless it's a private cloud, where you
unless it's a private cloud, then that's something else, yes. But for example, I'll give you, for UNHCR, when we decided to use Kobo, we didn't even go to OCHA, which is another UN agency. We actually spin up our own server just to make sure that it follows our own security standards and everything. And another thing that's really interesting when it comes to...
Again, you are lucky because you are a big big organization.
Yeah.
What about the smallest organizations that doesn't have the chance to have an IT infrastructure that would like to collect some information and kind of things?
But I think we can't give a general response because it depends on what type of data, what country, the consent of the people. If you have the consent and if there is a specific need that justifies the collection and the repeated visits. So it's all, the DPIA must be done taking into account all these different factors and plenty of others. So we can't give you an answer. It may be acceptable in some cases because there is a very strong legitimate interest. There is data minimization that still requires a lot of data, systems that are sufficiently secure and other elements. So it may be fully relevant and acceptable in some cases, and completely reckless and unacceptable in some others.
I think in a case like this, what I would do, because the problem is there is no clear answer. Number one would now have to see the actual data and play with it a little bit and sort of find out, what we could find out, what one could extrapolate from it. What I would practically do in this case probably is try to find a very smart person who understands this tech stuff and can sort of, play through the what would it take to hack through this stuff and what could one find out, and try to work with them. In terms of cloud-based versus server solutions, actually the cloud often is more secure de facto. I know if I now set up my own server, it's no good, right? Like my data personally is actually safer with Google, it just then also belongs to Google, right? So it's always a bit of a trade-off, and I think possibly the best advice is actually try to find providers that one trusts. Right, so both cloud-based providers, it clearly doesn't have to be Google and legally often can't be. Work with someone who seems reliable, who's trustworthy. Open source technology is extremely important because then the security community can look into it and actually verify that it's properly encrypted and everything. And the last thing I want to say is in terms of replacing names with numbers, for example, I think it's a really important approach. This is again where I think a data person needs to look at the data and find out, how unfine-grained is unfine enough. Does that make sense? So something that we recommended to the organization we're working with in these conflict settings is to say, if I don't go around and collect every person's GPS in their house, but if I tell everyone, meet me at this one location distribution place, and I only collect GPS data in this one place, then I never even, then the household data never even existed. So it's always good for the fine grain, the very personal stuff, to never even have been recorded at all, so it can't be put back together, because a lot of anonymous data sets together with some other data sets can suddenly be completely de-anonymous. It gets a bit, that gets a bit further, but the point being that a list that doesn't have any name put next to maybe a census, if a country has a census, suddenly you can if you're smart enough, right, you can re-anonymize things, and this is where it gets really scary.
Exactly. Basically, you can do it, like you can anonymize your data, but keep in mind that if you upload multiple instances with anonymization, you can still triangulate this data and track it. But I would just give quick advice. Even if you're like small NGO, even if you're sharing data with someone, make sure you don't put the data as is, at least encrypted with a heavy. For example, Z7 is an open source application. It's compresses the data, and it's provide AES 265 compression that it's, I would say, advanced encryption, and at least your data is stored well and is encrypted. But then it's not easy to be used. So you're basically uploading a file, then you have to download it, decompress it, and then work on it and upload it again.
So I just wanted to make I hope I'm not interrupting, but just make two follow-ups on the comments. One is that, again, it highlights and emphasizes the importance of literacy and community. I mean, great. I mean, finding somebody who knows and can look at the data, that's a great proposition. But if we don't plan for the resources, if we don't identify them, if it doesn't become part of the role of, you know, some specific actors, then how can we concretely implement that in the field? That's not going to be very practical. And the tools that we use, I mean, again, you know, the policy part, and we're able to check that, but we need to be able to develop the resources and the guidance for organizations to not have to do that legwork 100 times. If 100 times organizations are looking for the tool to do the same thing, then those should be evaluated and validated in a way that clarifies for everybody that that's safe to use or that's not safe to use.
Last question. There is a question here.
In the military and private industry, one classifies as data as secret, unclassified, public releasable, limited distribution. I haven't really come across this within the humanitarian sector, and it is a bit frustrating because we work a lot. We help UNHCR, for instance, a lot, and of course we treat this data extremely confidential. But there's no standards. OCHA doesn't have standards, and this is classified, limited. Some of our data is commercial data. There's licensing agreements. We can't share it. Yeah. Is there any plan? Because this is also important, right? Simple classification is something.
The problem that, when you're dealing, for example, government, again, it's one entity. But when you talk, for example, UNHCR, we work in many operations. Every caseload, every population has its own sensitivity. So for some population, maybe ethnicity is not an issue. And you go to another place where it's actually people are being persecuted based on that. So that's the problem. When it comes to UNHCR, unfortunately, everything is classified until we decide to release something. And until we, like for example, till now we don't have a clear policy on aggregated data. To which level, I mean it's coming soon, it's being reviewed now, to which level we can actually say it's aggregated, to which level we can say, yes, we can publish this number, like we're comfortable publishing this number or not. Yes.
But if you have, let's say, school locations, it's not, which you receive from somebody else, how do you store that within your own internal system? Is that public releasable, classified, limited? Is there a policy in place that for your operators to actually, I open this data set, even before I open it, already, or before I decide to share this, I already know this is the classification of it?
It's something that some people have suggested to include in the revision of the standards, to propose some kind of standard classification and criteria and guidance on how to do it. We are going to think about it. At first sight, I was not convinced, because classification can give a false sense of security, where you collect some data and classify it one way at one moment because of the circumstances. It's not confidential, it's not sensitive, but the situation changes, and it can become sensitive information. So it can become just a sample system where you, in the end, it's a big machine but doesn't make any sense. But it's still something that can be relevant, at least to help people think through criteria for sensitivities and confidentiality. So we are going to try to work on it, possibly as an annex, something that would be an illustration of the implementation of the standards.
If I can once again, sorry.
Okay, I think I will give you the last word, Patrick, and we need to close the session because unfortunately this is the end of our GeOnG. So, yeah.
Well, just on the classification, I think there's another classification that's important and that is not well addressed is distinguishing between what's the data that you must have for the services that you are providing. In other words, knowing somebody's nutritional status is essential if you're doing food security and nutrition support. What's the information that you don't have to have, but that actually makes the service better? And then what's the information that you really don't need to even improve the service, but it's nice to have because you can write proposals with it, because once we try to understand and segment these kind of data, it would also help only focus on the key information that is critical to collect. And again, an example, because it's been touted, and I think I have no judgment on it, I think it's very interesting, but collecting fingerprint, when is it something that you must have? When is it something that is nice to have because it makes the service easier? And when is it actually not necessary, but it's interesting or it's fun to do? And that should also guide the judgment around what data you collect and what risks it carries.
Thank you very much, Patrick. Thank you all, the panel.